Thank you all for taking some time on a Wednesday night to be with us to talk about something that is important to everybody that you see listed here, talking about fibroids and centering patients. I will already go and claim it that this will be like no other discussion you have ever heard about fibroids. Yes, we will be talking about any and everything related to fibroids, really focusing on the patient experience. But really, this discussion is going to be different than any one that I've participated in because of the illustrious panelists that I have joining me tonight and with their backgrounds. For those of you that do not know me, I am Dr. Veronica Gillispie-Bell. I'm a board-certified OBGYN here at Ochsner. I've been at Ochsner since 2004. I did my residency here and been in practice since 2008. And then among the roles that I have at Ochsner, I'm the medical director of the Minimally Invasive Center for the Treatment of Uterine Fibroids. And a lot of people that know me call me the fibroid queen, and many people know that I went into OBGYN to find the cure for fibroids. So I'm elated to be able to talk to you today, and again, to be joined by my wonderful panelists. I hope that you have a chance to read their full bios. In the interest of time, because we have so much to share and to discuss, I'm going to give a very short introduction to each of the panelists, but please read their full bios. You are looking at a group of very, very accomplished women. I first want to introduce Tanika Valbrun. Tanika is an award-winning journalist. She's a nonprofit leader. After her personal struggles with uterine fibroids, Tanika's desire has been to support herself and other women and that has inspired her to create the White Dress Project. And that's actually how I met Tanika, working together and hearing about the White Dress Project. And it's a nonprofit organization on a mission to raise global awareness about the uterine fibroid epidemic through education, research, community, and advocacy. Thank you for being with us tonight, Tanika. Next, we have Dr. Lauren Powell. Dr. Powell is a board-certified family medicine physician and culinary medicine specialist. We are in for a treat. Dr. Powell, also known as the culinary doctor, travels throughout the U.S. speaking at churches, corporations, conventions, and colleges, sharing her knowledge and insight regarding disease prevention and cure utilizing food. Thank you, Dr. Powell, for being here. And last but certainly not least, we have Tori Dixon. Tori is a licensed professional counselor. She specializes in providing compassionate and graceful guidance for those navigating various aspects of life. And she really has focused her practice on grief and loss, practicing from the belief that any barrier to mental wellness is ultimately attributed to some sense of loss. And so thank you for being here as well tonight, Tori. And I think that again, we have such a panel of distinguished guests, and we're going to talk about fibroids, I think, from a perspective and aspect that many of you have probably never heard before. For those of you that don't live in the fibroid world that we all live in, just to give you some information, fibroids are the most common tumor known to women, benign tumor. 80% of African-American women will have fibroids by the time they're 50. 70% of white women will have fibroids by the time they're 50. So again, very common. Now, we do see disparities. In addition to Black women having fibroids more often, Black women generally have symptoms about 5 years younger than their white counterparts. And we tend to have a greater burden of disease, meaning we have more fibroids, we have larger fibroids, and our symptoms are worse. But not only do we have a disparity in the way the disease manifests, but we have a disparity in the way that we offer options to Black women. There's data that shows Black women are less likely to be offered minimally invasive treatment options for their fibroids. And that's when we adjust for BMI, we adjust for age, we adjust for size of uterus, number of fibroids. We see that disparity that Black women are not offered those minimally invasive options. And it really is incumbent on all of us as providers to make sure that when we're having those discussions with our patients about fibroids, first of all, acknowledging and recognizing their symptoms, not being dismissive, but making sure that the discussions we have about treatment options are patient-centered. that we're listening to our patients to hear what their experiences are, that we understand what their goals of treatment are, and that we work together to come to the right option for the right patient. And I'm going to start the discussion tonight, if I can, with Tanika. And Tanika, I know you have been dealing with fibroids for a very long time, and I love. I'm not going to steal your thunder because I want to tell everybody about the White Dress Project and why the White Dress Project. But could you tell us about just your experience and also I think what your experience has been with the healthcare system?
Yeah, absolutely. So thank you, Dr. Gillispie-Bell, for putting this together. Thank you, Ochsner, for having all of us tonight. I think it's always commendable when doctors take the time to really hear from patients, hear what we're experiencing so that they can better serve patients. So I just want to applaud you for all the work that you do. I would call you the fibroid queen as well. Just knowing that your not only your professional commitment, but your personal commitment and your personal story just shows your level of advocacy. So I just wanted to highlight that and thank you for the work that you're doing as well. So my fibroid journey is very long, it's complicated, but when I think about it, it is a story of so many women who are suffering with fibroids. And I started the White Dress Project out of my own personal desire to feel not alone and unashamed of what was happening within my body, and to also feel that my body wasn't turning on me. And I think that is something that is often missed within the physician-patient relationship. And I think that it's a mental health component, which is why I'm so glad that we have Tori here tonight. I think it's something that you question about your nutrition, which is why I'm so glad we have Lauren here tonight. There's so many things you question, but when you get in the physician's office, we just have 5 to 7 minutes to talk about symptoms, and it's so much more than symptoms. So to make my story shorter and not longer, I have had uterine fibroid symptoms from my teenage years. So dealing with the heavy bleeding, frequent urination, what they call bulk symptoms, where my belly was often protruding, looking like I was pregnant. And I just dealt with it, multiple blood transfusions because I suffered anemia due to uterine fibroids feeding on my blood. And I just dealt with it all throughout college, all throughout high school. And I knew that there was something that wasn't normal for me. But I grew up in a culture that taught me that this is what being a woman is. You just have to wear pads, and you have to wear 2 pairs of underwear, and you have to wear a pair of leggings. So I just thought that this is what being a woman is like. So it wasn't until I started to have the multiple blood transfusions and recognized that I was always fatigued, recognized that I couldn't do things that my peers could do, then I started to really think of, is this really normal? And is this what I should be going through? I don't know how much you want me to get into my story, so please interrupt me at any time. But my mother also had fibroids, so I was familiar with what they were. Fast forward to getting married, my husband and I went to a physician to address the fibroids. And he told me that, I should save my money for a surrogate because my uterus was way too compromised. And as you talk about the patient-physician relationship, I think that is so damaging, and we have to be careful, or you all have to be careful as physicians when you're talking to patients about how we, I think, balance the clinical information that you have to give with the way that the patient is receiving it, right? So I think that hearing that and knowing that I grew up in a culture that said, go to school, get a good job, get married, and then try to have children. So knowing that I had done all of that, and then a physician tells me that it's still not enough, whether true or not, whether my uterus was compromised to the point that he felt like nothing else could be done, I feel like at the moment, it wasn't the most appropriate thing to say. So to answer your question, I think a lot of times, and I'm sure we'll get more into the work that we do and why it's important, but the physician-patient relationship during those critical times of diagnosis, what treatment options should we go to? How am I dealing with this on a mental health level are all things that physicians should be considering, not just trying to tell me that my uterus is the size of a cantaloupe and I'm not pregnant, that, we just need to get this bleeding under control. While all of those clinical things are important, I do think we need to balance it with how a patient can feel. And a lot of times, in the physician's defense, a lot of times that time isn't there. So I think conversations like this are important to make sure that you are hearing, from my vantage point as a patient advocate, here are the things that bothered me. And I can hear from you, your limitations as a physician, and we can come together and figure out what are the best solutions. So I'll just stop right there, just to not be long-winded.
Thank you so much, Tanika. That was a great way to kind of open us up, and thank you for sharing your personal journey, of the beginning aspects of your personal journey. And it is personal. So again, thank you, because that's a lot to reveal, to share with the world. So thank you for that. And I have 10,000 threads that I want to pull on from that. I think it is a societal thing that we normalize heavy menstrual bleeding. I am embarrassed, but will admit, I was a resident when I realized you're not supposed to wear a pad. Like, it's not normal to need to wear a pad and a tampon. That's just what I did. That's what I always did. I thought that's what it was supposed to be. So we were one day talking about double protection. I was like, is there some other way to do this? And so, we don't really, especially I think too, in our communities, when I say our communities, the Black communities, we don't talk about our periods. And so I think it is an unrealistic expectation for our patients to come in and say they're having heavy periods, or for us to ask them, are you having a heavy period? And Dr. Powell, I know as a family medicine physician, this is something that we've talked about just in the way that you approach your patients coming in, and how you ask those questions rather than making your patients tell you. So could you share some of that?
Yeah. Again, thanks for having me. I'm so thankful that we're having this discussion. But you're right. And just like Tanika said, oftentimes patients think their cycles are normal. So I don't ask my patients, do you have normal or abnormal cycles? Do you have heavy? Or because they don't know. To them, they only know them, they only know what their cycles are. And to them, that's normal. And even though, they may for half of the month be uncomfortable, for half of the month, they may be bleeding, they may have low energy, they're able to sort of function. And so to them, it's not like a problem. It's not like their arm is disconnected. And so they're not even going to complain. So it's oftentimes when I'm doing an exam on a patient, that I palpate and I can feel their uterus from the outside, that I say, what are your cycles like? Like, what is it like for you? And they'll say, a story similar to Tanika's where, well, I bleed heavy for maybe like 3 or 5 days. I'm changing my tampon every hour and I go through like a box every few days. And then sometimes I'll bleed for 3 weeks out of the month. And, and I say, you weren't even going to tell me? Like, you weren't even going to tell me unless I asked you. That's not a way to live. Like, how, I know you're used to it, but know that that's not normal and that you have options in there. Oftentimes women are like, I didn't know. They really just don't know. And so I feel like it's our job as physicians to ask the right questions, because patients don't know what to tell us. And that's not their responsibility. The only thing they're responsible for is to answer our questions as to how they feel and what their symptoms have been. But I think it's just important to note that we ask the questions, because oftentimes patients aren't going to complain because they're not talking to multiple women and know that what's a normal cycle and abnormal cycle. All they know is their cycle. They may know their moms. They may not even know that. I mean, I feel like in my household, we didn't even talk about that kind of stuff. And so really it's up to us to ask the right questions.
Yeah, I think that's very, very true. Yeah, as a side note, speaking of talking to parents, it's a wonder that I got to be a gynecologist, because my discussion about like your periods and that kind of stuff, I was given a handout to read because we just didn't talk about that. And I think, Lauren, you pointed out some very good things, and starting to get into that discussion once you have asked the right questions, the then what. And the literature shows that it takes patients that have fibroids about 3 years and 3 doctors before they get to the right doctor. And a lot of times that is because we as doctors tell patients, yes, it's kind of similar, Tanika, to the journey that you had. You have this situation, you're having this bleeding, a hysterectomy is the best option. And it's not the only option. It may be the best option for some patients, but it's not the only option. And the fact that that is the first thing that's offered a lot of times has also been shown to be a reason that patients don't come forth to seek care, because they think it is the only thing that they can do. Go ahead, Tanika.
I just wanted to add to that I think it's really important for physicians to think about this catchphrase that we're saying right now, which is, or term, which is shared decision making. And really patient satisfaction, I think at the end of it, outside of not, being medically unsafe or, not appropriate for the patient, patient satisfaction should be at the top, if not close to the top, of the physician's desire for the patient. So even if there are things that you don't, as a physician, don't perform clinically, you don't do this, you need to refer out, you need to ask additional questions, as Lauren mentioned. And I think a lot of times doctors are just doing what they feel is in their best interest and their best interest of what they feel like the patient needs. And I think there's a gray area in there where what the patient needs, or clinically what needs to happen, what the patient desires, and what that shared decision-making outcome can be. So I think a lot of times it's not thought about that way. And to Lauren's point about, asking the right questions, I think it's so important, but we can't all be blessed with a primary care physician like Lauren, right? So many times in our community, we hear about the fear that patients have for the person in the white coat. So whatever they say goes, and there's often not a lot of conversation or dialogue around that. Doesn't feel comfortable to me. What else can we do? Do you have somebody you can refer me to? Because we just fear that it's disrespectful. And I think it's also a cultural thing, right? In the Black community, we don't talk about issues below the belt, and we definitely don't go in there disrespecting the doctor or your teacher. So we just have those kind of cultural things that we've been taught that we don't do. And I think we need to get over that.
One thing I like to empower my patients to say is, you're the boss. Like, you are the boss of you. And if there is a recommendation that doesn't feel right with you, I know you're not medical, but if it doesn't feel right with you, then let's have another discussion. Let's meet with somebody else. I think it's important to remind patients that just because one doctor said something, you're not committed to that. You're not committed to that provider. You're not committed to that plan of care. We can see multiple people. And I tell patients, even me, I'm a great doctor, but maybe I'm not the best for you. And that's okay. You are the boss of you, and you are the boss of your health. You have to go home with you every single day. And so it's important that you make health decisions that feel good for you. And I'm just here to give you information. Like, that's purely my job. And if there's information that I don't have, I'm willing to partner with other people to help give you that information. So I think it's just important that, because I think as a patient sometimes, and I know, like, I've been a patient, it can feel very like you have no power and you're at the mercy of like this other person. When I was going through my infertility stuff, it just felt like I had no control. And I think it's important that we just continue to remind patients that they do have control, that this is your body, this is your health, and you have control. And so just kind of reminding that and continuing to have those conversations with patients, I think, are important.
I 100% agree. And, we as physicians have to treat our patients as informed consumers. And I've said this on a different panel for patients, for them, like you said, from an empowerment standpoint, you wouldn't say, okay, I need to buy a car and go to the Honda dealership. And then the dealer come out and say, you have to have a red Honda Accord this year, blah, 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 blah. No, you would expect the dealer to say, these are your options. What are you looking for? What's going to be the right car for you? And then if you don't like what you're hearing, you're going to go down to the Kia dealership or whatever. And it's really, I mean, I say it in jest, but kind of not. It really is the same thing, that your healthcare, you are an informed consumer, and you can make those decisions. And then Tori, I want to turn to you to pull on another thread. We talk about hysterectomy and that being offered so often. And we talk about Tanika and the experience and being told when, you just got married and you're thinking about your life and the family that you're going to have, and that not being supported by your care provider. Now you deal with loss, and I think loss happens in a lot of ways, in ways that we as physicians don't think about it. So can you tell us some of the experiences that you've had with patients?
Thank you so much for having me. The thing that you mentioned just a second ago about listening to yourself and having the opportunity to be a self-advocate, what I come to find is that because women are waiting longer to have their health screened in that way, and they haven't been believed in so many instances in terms of the pain and the discomfort and the life-changing spaces that they are experiencing, the first thing that happens is they begin to doubt their own voices. So it becomes so challenging for them to then go into the person that they deem to be the professional, which you are as a doctor, but they've gone to 3 other doctors and told them, I'm in excruciating pain, I can't sleep at night, I have no energy, and they're saying, well, it's not that bad, it's normal, like this is, and you're like, I know something is wrong with my body, and nobody will check. So the first thing that happens is you almost start to demonize your own voice. And now what you say isn't as important as what's being said. So now it's challenging to advocate for yourself. And in speaking of loss, that's kind of one of the first things that ends up happening is we lose the confidence that we have in knowing ourselves enough to know and to speak out and to speak up to our physician about what's exactly going on in our bodies. So now I'm going through this anxious tug of war between my body and my mind because my body is telling me something is wrong, but everyone has said nothing's wrong enough for there to be anything done. So who's right? Am I gaslighting myself? Am I just being extra? Am I, catastrophizing a thing? Well, everybody has cramps. Everybody has discomfort. Everybody has PMS. So what makes yours so much different than anybody else's? And then you go years and you're having this pain, and then it turns into maybe even fertility concerns. And you're like, I knew it 5 years ago that something was wrong, but nobody listened to me. So my hopes is that as we talk about, as Tanika mentioned, with shared decision-making, I'm hoping that physicians will empower patients to listen to their own voice. You know your body better than anybody else does because you're the one living in it. And so when you can be empowered to have that voice, it changes in many ways. When physicians give you the power to have that voice, when my clients sit on the couch and I tell them that you are the expert of your life, I'm not, I don't live it, it changes the narrative. So now they come in and they're more apt to be open in conversation with me than they would otherwise.
Thank you. And I have to say, from a disparity standpoint and a systemic racism standpoint, I think even more Black women have to speak up. Through the different archetypes throughout history, especially in gynecology, one of those archetypes that has been made to shape Black women is the angry Black woman. And it actually is not just an archetype, but it also is a way of suppressing our voices, because then we don't want to speak up because we don't want to be the angry Black woman. And so I think it is so important for what everybody is saying here to empower our patients and to give them that platform and that security that I hear you and I am here to hear you, because there is so much I feel just as a barrier for being able to speak up as a Black woman when we think about those things. And now, Tanika, I'm going to turn back to you as you continue your journey. And at what point in your fibroid journey did you create the White Dress Project? What was that transition for you?
So it was after, as I previously mentioned, that physician told me, go ahead, save your money for a surrogate. I was completely devastated. It's so clear in my mind. I walked out of the office into the parking garage and literally fell and cried, because like I said earlier, you feel like you've done everything right until somebody tells you that you haven't. So I was very devastated by that, but I was also determined for that not to be my story. And like Tori just said, you go through all the emotions of questioning your own voice and knowing that something was wrong. And I thought back to the time when a physician told me just to watch and wait with my fibroids. Let's just see what they do. Well, they did a whole lot and took up a whole lot of space and caused a whole lot of bleeding. And, I did think back to 5 years prior and 3 years prior and what I knew in high school. So it was a very devastating moment for me. But shortly after that, I found a physician, and she said to me, yes, my uterus is compromised. However, we're gonna do what we can. So even if it was in the clinical world, the same outcome, it could have been the same outcome. She just handled me so much better and gave me hope. And I felt comfortable in knowing that she was willing to try for me. So that was my first myomectomy. I had 27 fibroids removed at that time. It was during that recovery that I said to myself that this doesn't make any sense. Like, I don't understand why there aren't more people talking about uterine fibroids, shouting it from the mountaintops. But I thought to myself, when I have these conversations with my girlfriends or in small groups, we kind of conclude that everybody has fibroids, and it's, it is what it is. And we kind of resort to normalizing it and just feeling like that is kind of our plight in life. And I just wasn't okay with that. And I wanted to, my mother had fibroids, as I mentioned before, but I wanted to feel that I wasn't the only one that wasn't wearing white. I wasn't the only one that was, canceling plans, not buying any cars with cloth seats, always putting, mattress pads down. If you need a good mattress pad recommendation, I'm your girl, because I have gone through, so many products that aid in helping avoid mistakes or dealing with accidents. So I just wanted to feel, once again, normal, or what I felt like would be normal. So I walked into my closet, realized that I did not have any white clothing. And for me, that symbolized how much I had sacrificed in my quality of life. And one point I want to make to the physicians who are on the call is that it's really, I don't know if it's about using the word normal, but it's about saying to your patients, how are you altering your life for this? What's changed? What's going on with your social life? Because I think all of those things can be indicators of a person who is dealing with something and maybe not know how to articulate it. So I wanted that for myself, and I wanted that for my community. I wanted that for my friends. I didn't want this to feel like it was something that should be shunned or we should be embarrassed. So that's where the White Dress Project was born. In week 5 of my recovery from 27 fibroids removed, in my closet, as Oprah would say, I had my aha moment, and I wanted to use the color white, not just as white, but just anything that represents light colored anything, right? I didn't have anything light colored in my house. Black sheets, black towels, black cars with black leather seats was just my jam. And I just wanted to not feel that way. So I started the White Dress Project to create community and to let people know that they can talk about this. This is not anything that you're doing wrong. And it has blossomed into a national, international, I'm so proud of it, global organization that encourages people to share their stories and to connect with doctors like the ones that we have on the call, so that we can really, once again, get back to this shared decision making. Dr. Gillispie, I think we lost you maybe?
I believe
No,
it's an
I don't know.
internet
My
problem,
camera
but
Oh, okay.
okay, great.
randomly turns off. I'm not sure why it's been doing this all day. I was
Yeah.
like, please not in the webinar, but it did it. No, but thank you for that. And I mean, how inspiring to take your experience. And I know you've helped thousands and thousands of women to not have to suffer in silence. I just think that is amazing. And I know we don't have time to go into all the accomplishments, but I mean, you've been instrumental in legislation, and now people are actually funding us to research fibroids and treatment options. And I think that's amazing. And, you know, just to share with the audience, just what advocacy can do. And I do think directly or indirectly, your advocacy, Tanika, has led to this. When I was in college when I decided I was going to find the cure for fibroids. And the reason was because my mom got diagnosed with fibroids and was having a hysterectomy. And I was like, wait a minute, there's nothing, there's no options. All she can have is a hysterectomy or take a crappy medicine to have a smaller uterus, to have another to have a hysterectomy. Like there's nothing. I was like, I'm going to find the cure for fibroids. And that was in 1999. And it wasn't until 2020 that finally two medications got FDA approved as oral treatments for heavy menstrual bleeding for women for fibroids. We're talking about 20 years before there was something. And part of that is because there's been no funding, no money to do research for women issues in general, but specifically for fibroids, partly because of who is mostly impacted. But there's been no research, no money for research. And so I am very happy to see that the fruits of your labor, Tanika, that now there is funding. We have even the vice president sponsored a bill from when she was a senator, from her suffering from fibroids as well. But it's just really inspiring to see the work that you've done. So thank you for all that you've done.
Thank you for saying all of that. And I feel that doctors need to recognize that the patient voice and the stories of patients are really what drive change, because without these anecdotal stories, you don't really have the data, right? So our stories drive data, our stories drive research, our stories drive clinical trials. And I think if we look at it that way, then as a physician, you can become more invested in what you are doing for your patients and how you're listening to their stories, so that you can extrapolate the necessary gems and data from it that can lead to additional research and how you treat your patients. And from the patient standpoint, you know, a lot of times we don't know how to tell that story. Like Lauren alluded to that earlier, we don't know how to tell that story. But I think as physicians, if you are aware that there are, I call them gems, but if you're aware that there is vital information in the story of your patients, then you will, I think your mindset changes a little bit about how you approach them and how you hear those stories, because it really is the foundation to everything that is happening in medicine and in science. That is ever changing, changing. You all are practicing. We are practicing. We're all out here practicing life and doing what we can. So yeah, I think it's just a change in mindset and a different way for physicians to look at how they interact with their patients.
It's so true. It's something we say in the maternal health equity world. And it comes from Natasha Rouse, who's a patient, advisor. We say nothing without us. I mean, nothing for us without us, meaning don't design something for a patient if you haven't had a patient to tell you what they need. And I think that's so important. And then, and switching gears just a little bit, but staying in that same vein, I want to come to you, Dr. Powell, because I know commonly patients want to know, well, what can they eat to make their symptoms better? What can they do? Even if they know that surgery is an option, whether that be a hysterectomy or myomectomy, or now we have a radiofrequency ablation, but they want to know from a nutrition standpoint, what should they be doing? How do you counsel those patients?
Well, I think first of all, food can be very confusing to people. We don't know like what's good, what's bad. Do we eat carbs? Do we not eat carbs? Fat? Do I eat fat? Do I want it? Vegan? Like food is very confusing for patients. And so I think it's important that we're always trying to have these conversations with them, no matter what health condition they have. So first thing and I took a couple notes because I knew we didn't have like a ton of time. And so I didn't want to just be talking and talking. So first, I want patients to kind of keep some kind of objective data, because oftentimes we're making dietary changes and, food is something that's slow. It's not something where, you take an Advil and all of a sudden your headache is gone. Food and lifestyle changes take time. And so I like patients to write objective data so that we can look back and we can see kind of how they feel different. So I want them to be tracking their cycles and what those look like and how they feel. I want them to be tracking their stress and how their stress is, how their sleep is. I want them kind of keeping that information so that we can see when we look back on some of their dietary changes, how those things have changed. So just a couple of food things. I always go over alcohol consumption. I want to know, what alcohol they're drinking. Beer, of course, has had a positive association with fibroids. And so I want to make sure that they're not consuming any heavy alcohol, but specifically beer. I talk about their red meat consumption. Red meat is very inflammatory. It's not good for a whole lot of stuff. So I'm always wanting to make sure they're avoiding red meat if possible. Something else is vitamin D. That's kind of in the nutrition range. We know that 74% of African Americans tend to be deficient in vitamin D. And there's been this dose-dependent relationships that we've seen in women with vitamin D deficiency and fibroids, meaning those who have a lower deficiency tend to have larger fibroids. So really beginning at age 16, I'm screening my patients for vitamin D deficiency. And, I think it's also important to remember as primary care physicians, when we're looking at what's considered normal, that those ranges that we see in our labs that we get from Quest or from LabCorp, those ranges were based on, white men in medical school. And so those ranges, while they may be normal for that group of people, they're not universally normal for everyone. So while, 20 may be normal, I'm liking to see my African-American females somewhere in the ranges of 40 to 50 for their vitamin D levels. And so I'm going to make sure that they're taking whatever supplementation to kind of stay at that level. Soy has been a mixed bag. Again, I'm asking them to just avoid heavily processed food. Of course, edamame and things like that are great, but again, I'm wanting them to just avoid the heavily processed food. Green tea extract has shown to be beneficial, so I'm asking them to incorporate that in their diet as they can. Of course, there's this link between fibroid and estrogen, so I'm asking them to kind of decrease the hormone-rich foods when they're eating things like chicken, to eat organic. When it comes to dairy, I'm asking them to avoid dairy and kind of consume more of the nut-based milks if possible, if they are, someone that likes milk. In general, I don't want adults drinking dairy. I don't like them drinking dairy milk in general. And then I'm asking them to increase foods that block estrogen. So that's our flavonoids, that's our fruity vegetables, our colorful vegetables, and our fruits and vegetables. And so with patients, it's hard to tell them, like, I want you to eat this vitamin or that vitamin. So what I say is when you are making your plate, try to make sure it has at least 3 colors. 3 colors are making sure that we kind of have this diverse nutrient profile. Vitamins, like we know, I know we're all medical professionals here, tend to come in different colors. And so if you're eating this color, you're getting this vitamin A, vitamin B is in this color. So try to every plate to have at least 3 colors. I like half that plate to have vegetables. In general, I like my patients to be eating 7 to 9 servings of vegetables a day. That's not going to happen on its own. So that requires a lot of planning. That means that every single meal needs to have vegetables. You can't just save peas for dinner and think that that's enough vegetables throughout the day. In general, people are not eating enough vegetables, but they think that they are. So just always having the conversation about how much vegetables that people are consuming. Like we said before about the increased incidence of fibroids in African-American women, Black women tend to have higher fat composition, like Asian women who have the lowest fat composition and also the lower incidence of fibroids. So just having those, those conversations about what we can do to decrease excess fat. Then the last thing I just like to talk about is blood pressure. Just because I'm a primary care physician, we've seen kind of this relationship between increase in diastolic, so that bottom number of the blood pressure, and the incidence of clinically detected fibroids. So I'm very aggressive with blood pressure, both when the patient is not pregnant, and then of course when they are pregnant as well, because we've seen some uncontrolled blood pressure with fibroids in pregnancy as well. So those are some of the lifestyle stuff, and then just things in general that we do, managing people's stress. How are you moving on a daily basis? Making sure patients are getting enough sleep. All those things are super important as well.
Mm-hmm. That was so very helpful. I'm taking little notes over here on the side. It was very, very helpful. And to that point, I also tell my patients after they've had a myomectomy, well, whether they had a myomectomy or not, but I always get that question, and I always tell them, if we can take out your fibroids, but we can't stop the process of you making new fibroids. But I do always recommend vitamin D3 because there is literature that shows that reduces the risk of recurrence. And I myself take green tea and a green tea and turmeric little extract pill every morning to help with my fibroids too. So
that's good. And I would say the lifestyle stuff really does work. Again, it's not this thing that's instantaneous. And no matter what treatment you're undergoing for fibroids, it's something that you need to be doing, whether we decide to move forward with a hysterectomy or whether we're doing something less invasive. It needs to be a part of your treatment plan. And I phrase it like that with patients, like, this is a part of your treatment plan. You exercising, moving your body every day is a part of your treatment plan. You putting good food in your body is a part of your treatment plan. And so we have to agree that this is something that you can do. And if not, we need to figure out what resources and things that, we can do. I can say that, after my father had his stroke when I was in residency, and I kind of made a lot of changes with my health. And that's when I kind of really went on the food as medicine journey. I've really been kind of living this type of lifestyle. And when I was going through my infertility stuff and had to have, an ultrasound, that's when I discovered I actually had a small fibroid. And I charged the fact that it wasn't kind of clinically significant due to my lifestyle, just due to this way that I've been living from a very kind of years. And so I think it does make a difference. No matter what treatment course we end up having to go on, I think it just matters.
Mm-hmm. You hear me still? I can't.
She's back.
Low system resources may affect your audio quality. I don't know what resources are happening, but okay. And so, Tori, before we open it up to the audience, I want to go back to you. We've talked about nutrition. We've talked about that physical wellness. Can you, for everybody that's on that is not a part of the panel, Tori started us with making us take a deep breath. And what I realized is I'm not breathing deep. I guess I'm guppy breathing or something, because my deep breath, she was still blowing out and I had been blown out. So Tori, if you can kind of talk to us about our emotional well-being and how that affects our physical well-being.
This is such an amazing conversation. I am completely convicted after hearing Dr. Powell's food rundown. Well, I'm a little bit convicted. I've kind of done my own, having to take care of my own body and seeing how doing some of these things was not only just impacting my physical wellness, but it was also impacting my mental wellness. The one thing that I want doctors to understand, and the audience in general, is this: you are not a compartmentalized individual. You don't have like the shoe department, like the mall. You have like the shoe department and then the perfume department and then the purse department. You are actually one full body. You are a whole person, and what's happening in your body affects what's happening in your soul, which affects what's happening in your mind, which affects what's happening in your brain. So it's funny that everything that Dr. Powell was talking about in terms of what you can eat and what you should do in terms of your physical body and fibroids, all of those things are equally as important for your mental health and wellness. You have to exercise, move your body. You have to sleep. We are the most sleep deprived nation in the world. We do not sleep enough because we hustle hard, and Black women are at the top of the list of women who do of people of subsectors in this country that does not get enough sleep. You have to rest. So when your body is hurting, right, it sends what we call psychosomatic symptoms. So you start to feel depressed, you start to feel anxious. If you are bleeding heavily, all of that is going to contribute to your energy level, which is going to contribute to your ability to be focused. It's going to contribute to your ability to complete tasks. It's going to contribute to your inability to make decisions, and all of those things, whether you know it or not, all of those things are symptoms of both depression and anxiety. So sometimes when my clients come in and they sit down and they talk to me and they're saying, I'm not feeling well, and these are the things that's going on in my mind. I feel depressed. I feel anxious all the time. I cannot sleep. And then I ask them about what's going on in their bodies, and they say, man, I've had my period for 3 weeks. And I say, wait a minute. Let's sit down and let me refer you to an OBGYN, because your mind is telling you that something is going on in your body, or your body is telling you that there's something going on in your mind and it's expressing itself. So a woman with fibroids, you have to understand that you bleeding profusely for weeks or months at a time, it's going to impact your emotional and mental wellness. Yes, you are going to be fatigued. Yes, you are going to have difficulties concentrating. Yes, you are going to have crying spells. Yes, you are going to be on an emotional roller coaster, particularly, especially when Tanika talked about your lifestyle changes. When you cannot live a quality of life that speaks to the character of who you are, it's going to impact you mentally. So you have to be mindful that what's going on in your reproductive cycle is not just going on there. It's going on everywhere else. As Dr. Powell speaks about your nutrition, it's actually going on in your mind, and it's going to impact your brain functioning.
I just want to add to that. I think I love hearing Tori Talks because I feel like, is that your Instagram handle, Tori Talks? That's you're on
When Tori Talks.
When Tori Talks. I knew it was close to that. But yeah, I love to hear her talk because she just makes it so real, right? It's just so plain and clear. And when I think about when she said, everything is connected, I just like scanned my body and I thought to myself, yeah, the moment that I feel pain, I automatically also feel my shoulders tighten. And you feel like, whether it's true or not, you feel like you get an instant headache. Or when you hear bad news, right? You have all these like physical things that happen. So I think I just wanted to agree with that. Just as a patient, just thinking about all of the ways that we need to train our brains to think that we're not disconnected. I'm reading this book right now. It's called The Myth of Normal, and it talks about this idea that all of the way we live in our society is really not normal, and we've so normalized so many things. And when I think for so many years how I just normalized my bleeding, like you said, Dr. G, thinking about wearing a tampon and a pad, I would go into the store and I would say, who are these people wearing tampons? Like, it's just like, how does it even hold anything? So I just didn't even like have the concept that bleeding that minimally was a thing. So yeah, that I'll stop there.
I'm so glad that you said that, because one of the things that you mentioned, which we do quite often, is we call it a dissociation. So we actually dissociate what's going on in our bodies from what's actually going on in our minds. And so what I like to do, even today, when I came on and I had everybody breathe, I wanted them to notice where they felt the lack of breath in their body, right? So I told you, I said, you guys stopped right here. Nobody's breath went all the way down till their stomachs pushed out and then that air came through. So whenever even you're feeling pain, when you're even feeling anxiety or you're feeling sadness, I have my clients close their eyes and I ask them, where do you feel that in your body? And sometimes they say, well, you know, I feel a heaviness in my chest. Or sometimes I feel like butterflies in my stomach, or I feel weakness in my legs. Because what I do is I'm trying to get you to bring everything back in order. We have to get everything touching. Your body and your mind and your spirit should not be three different compartments that's doing and living its own thing. It should all be one working in conjunction, because that is what makes you your person. That is what keeps you connected. And in our society, we practice disconnectivity so often that we make disconnectivity personal. So now we don't know what happens when we feel depressed. We don't know that we feel it in our body, and that pain in my chest is not normal. It's not supposed to be there, but there is something going on in my mind that's impacting something that's going on in my chest. But if I don't bring my mind and my body into alignment to be one person, then I'm never going to actually do what needs to be done either in my mind or in my body to make me feel well.
Tori, can you just be my life coach?
That part, after me.
I think it's also important to note just, you know, an additional barrier that Black women may face in getting care. I know we talked about, you know, having a physician that we feel comfortable with, but you know, I'll have patients that delay care because of their work environment. They're in a male dominant place and they feel like to get their fibroids treated would require them to be off work, and they don't want to do that. They don't want to set the tone. You know, they're the only Black woman there, and so they feel like they kind of have to, you know, hold themselves in a certain way, and maybe being treated for fibroids would seem like a weakness, and taking time off for that, and their male counterpart is not going to understand because they don't have a uterus, and you know, and so I think it's important again that we just have these conversations with patients. Remind, this is a medical condition. You can have FMLA for the, you know, it makes me sad that women almost feel like this is a luxury thing to be treated. You know, I almost feel like sometimes fibroids and fertility, women just delay it and they feel like I can get up and I can walk and I can see. And so that's just like a luxury thing that I don't get the pleasure of being treated for. And so just reminding.
We also need to consider here, Dr. Powell, not to interrupt you, just the over-sexualization of Black women and Black women bodies anyway, and how that too contributes to Black women not seeking the care and reproductive health that they really need to seek, because you have the 70s idea of the welfare mom, and she just is having kids after having kids after having kids. And so as a Black woman, you shouldn't have issues with having babies, because that's all y'all do anyway. So when you have this stigma, this racist and white supremacist ideology of the Black woman's body as being a sexual, you know, just for sexual reasons, then why would you care for the health of that body when it's only there anyway for our amusement, our entertainment, and even our experimentation?
Right, absolutely.
That is a whole nother hour. I touched on it a little bit with the angry Black woman. Now you've touched on Jezebel. We've heard about this. So that's a whole nother discussion, and how those archetypes have really played into the way we think about Black women, specifically in medicine. Definitely, it's a whole nother hour that we need. If anyone that is not a panelist, that's here as an attendee, has any questions, please put them in the Q&A. Otherwise, as you see, we will just keep on. We're gonna keep on talking. We have about 5 minutes left. I guess as we start getting towards the end of this, and I apologize because I did not tell y'all I was going to ask you this. I'm going to come to each of you just to see if you have any closing remarks. What is the one thing that you would like to leave with the audience, or just that you would like to leave with us tonight? And Tanika, I'm going to start with, since we started with you, I'm going to start with you.
Yeah, so I would like to leave, Dr. Powell alluded to this area that earlier, that you are the boss. And I always say that. I always say that I am the CEO of my body. Nobody knows my body like I do. And while I respect your 4 years of medical school, your 4 years of clinic, your 2 years of fellowship, I respect all of that. You're still not living with me daily. So I think patients should feel empowered knowing that. So you're the CEO of your body, and I know this is a physician audience. So I am telling these things to you so that you can empower your patients to think this way. I think that it's important that patients find a tribe of people who they can share with. I think going through any reproductive health issue or going through any health issue can be overwhelming on top of all of the other things that life requires. So I think finding a tribe, especially when you get a diagnosis like fibroids, physicians often call it benign tumors. So when you hear that, you just, go to Dr. Google and then you think your life is over. So I think finding a tribe, even taking someone with you to the doctor's office, I think telehealth has afforded us to bring people with us that when you're getting all of this information, there's a friend there who can help you synthesize a lot of what is being said. And the third thing I would probably say is just to share your story. And as physicians, please encourage your patients to share your stories. If you only have 7 minutes, ask them to, I had a doctor kind of shun me when I did this one time, but I think it's so effective. She asked me what was going on, and I took out my journal and I just wrote for about 2 minutes. And then I had her read it because I just didn't have it in me to, audibly just explain to her what was going on. And it was weird for her at first because I wasn't talking, I just wrote. But she got an understanding of the pain. She understood the emotion. And, for the first time, I just felt that I took my power back. So I just want patients to understand that, and within that, share their story and know that their story is really where their healing comes from. When you share your story, you understand, back to Tori's point, how not only are we connected in our bodies, but we're all connected together as humans, right? That's why we can feel pain for others and feel pain for people we don't know, because we're all really connected. So share your story, understand that you are the CEO of your body, and know that your story matters, and find a tribe.
Thank you, Tanika. Dr. Powell?
I would say, as a primary care docs, our patients are often going to come to us first before they maybe see their OBGYN. So just making sure we ask the questions. I am not afraid to image early. If their cycles aren't not normal, I basically it's a non-invasive thing, and early detection literally can change their treatment options. It literally can be the difference of something very invasive or something not. And so I'm of the mindset that more information is better. And so I just, be quick to ask the questions, quick to get labs, quick to image, and, quick to refer so that these patients can know their treatment options and know them early. And even if the treatment option at that time is discontinue to monitor, at least they have a relationship now with someone that when things are not feeling well, or, now it's year 2, year 3 of monitoring and things are looking a little different, they already have somebody that they have a relationship with. I have a list of providers. I'm in Atlanta, so I have a list of providers that, I have a relationship with, that I know we can text each other in the middle of the night when I'm talking about a patient, or I'm looking at labs, or I'm looking at stuff. And so I think that's important. I think a lot of, in the healthcare system, it's become very fragmented. And as a primary care physician, I feel like it's our job to make it very comprehensive and make it easy for the patient. Healthcare is hard, but it shouldn't be. It shouldn't be for the patient. So my partner, who always says that we need to make it as easy as possible for patients, if we can help them make appointments, if we can do a good job of staying in communication with their GYN. Patients don't know what the ultrasound said when they went to, they don't know that stuff, and it's not their responsibility. So just making sure that we're communicating with each other, so really we can just give people the best care possible. And that's what, in my mind, that's my goal every day. Like, what can I do for, like, what's the best that I can give them? And that's what I'm going to give. And when I've given my best and there's nothing left for me to give, then I'm going to get some help from somebody else that can help too.
Thank you for those words. That was amazing. And Tori, give you your last words.
To every woman that will watch this broadcast, to every woman who's watching it now, the first thing that I want to do is validate your pain and tell you that your pain is real. It really happened. It's really happening to your body. And I am sorry that someone didn't believe you and they didn't hear you and they did not take your concerns seriously. But let me tell you, there are people with boots on the ground, 4 of us here in particular, and we are fighting for you. You do not have to suffer in silence. You do not have to suffer alone. There is help, hope, and healing for you. And what I'm going to encourage you today is do not grow weary. I know it's been a long battle. I know this is the 5th doctor. I know you're tired. I know you can't read the scans. I know you're exercising. I know you're eating well. I know you're sleeping well. I know you're looking for a therapist. Do not grow weary. Make one more phone. Reach out to one more professional, ask one more question, save one more number in your phone, look on one more Instagram page, make one more DM, do whatever you have to do to fight for your, and know that you are not fighting alone. You have a tribe of people who are praying with you, who are waiting for you, who are hoping for you. And what I know for certain is that if you do not give up, you will reap the reward, whatever that may be, in your due season. So I pray this is the season for you.
Oh, that was beautiful. Thank you, Tori. And I'm just going to leave with, because we are past our time, I'm just going to leave with the last departing words for the providers. A hysterectomy is not the only option. There are so many options available to patients now, from medications to minimally invasive surgery. Hysterectomy is an option, and that's the right option for some, but it should not be the first thing that we lead with when we counsel patients. There are many options available. Please visit our fibroid website on ochsner.org. There is a pamphlet there with all of the options as providers that you can offer patients. If those procedures and those you're not familiar with the options, that's okay. Get the patient in, refer them to the fibroid center so that we can get them started on a pathway to treatment. I want to thank all of our panelists for being here tonight. This was an amazing discussion. I could stay here for another hour. I'm afraid the Zoom is going to cut off at any moment. But thank you so much for being here. I hope we can do this again. Appreciate all of you. Jacob, thank you so much for being behind the scenes and organizing us and keeping us together. We really appreciate you. And for indulging and being in the conversation and not being afraid to hear women talk about their periods. Thank you, Jacob, for that support as well.
I'm happy to be supportive here. Y'all definitely had me crying a couple times there. So it was a really good session. Thank you so much for this conversation.